Namaste, my name is Dr. Arrjun, consultant surgical oncologist at Renova Century Hospitals, Banjara Hills, Hyderabad. Today, I shall be talking to you about lung cancer. The incidence of lung cancer is unfortunately increasing in our community, especially so in India. The causes for this are many. It could be because of the unfortunate increase in smoking amongst the young people in our community, the increase in vehicular pollution, the increase in overall environmental pollution as well, the increase in household pollution, especially so in villages, where people still unfortunately use a lot of wood-based material for cooking, and also on genetic risk factors over which we have no control. What are the symptoms for lung cancer? These are usually breathlessness, which is new in onset, which has started recently over the last 1 or 2 weeks probably, or maybe over the last few months, something which we didn't have over the preceding months. We are noticing that we are having difficulty in walking, maybe in talking, maybe in on breathlessness on lying down, something which again wasn't present a few months ago. Difficulty such as hoarseness of voice, maybe we are having some bloodstained sputum as well, or other features where we notice that we have a loss of appetite, we are not able to eat as well as we were able to eat before, or other features such as where we are noticing that there is a loss of weight, we are noticing that the belt buckle is fitting a little too loosely right now and we need to tighten it a little more. These are as you would have noticed, all of the symptoms I just told you are all extremely non-specific. None of them actually do point to lung cancer, which is one of the problems which leads to a delayed diagnosis usually in lung cancer. And also the main problem is most of the patients are not able to appreciate the lung is not visible from outside. So they're not able to put their hand over a swelling or anything else which is visible from outside, which raises a suspicion because of which they end up coming to the hospital. So what we as healthcare professionals can do in such situations, for people who have a long history of smoking, probably over the last 10 or 15 years, we can offer them either a chest x-ray or a CT scan as a mode of screening. And even if a patient does come to a hospital, the usual investigation which we would do for such patients would be either a bronchoscopy, where we would be inserting a camera through the nose to inspect the inner aspect or to visualize the inner aspect of the lungs and the breathing tubes as well. Or if we think it's required, probably a chest x-ray or a CT scan as well. And if unfortunately a patient is diagnosed with lung cancer, the usual modalities of treatment which would be offered, if a patient luckily presents at an early stage, we would be offering surgery, and the surgical procedure which is usually done is something which is known as VATS, which stands for VATS, video assisted thoracoscopic surgery, where multiple small holes will be placed over the chest, one of which will be carrying the camera, and long fine instruments will be inserted through the other holes in order to perform the surgery. As the size of the incision is so small, the recovery of the patient is invariably excellent and we are able to discharge him within a few days at the max. The other modalities which usually go hand in hand with surgery, which can either be given before surgery or after surgery, would be either chemotherapy or radiotherapy. If you or any of your loved ones are unfortunately suffering from any of these symptoms, the ones which I mentioned earlier, please don't hesitate to reach out to us at Renova Century Hospital, as we have an excellent team over here. Here's wishing all of you a healthy and happy long life ahead.